What is EndoFusion? EndoFusion, in short, is a new minimally invasive spine surgery, also called as endoscopic spinal fixation or endoscopic assisted spinal fusion. In this technique, the surgeon uses a tiny endoscope, a camera tip tube, a rigid tube like this, goes through a small incisions to fuse two or more vertebrae in the spine. In simple terms, EndoFusion lets us to stabilize, realign the spine without the big cuts of open surgery. For example, one description notes that EndoFusion is minimally invasive spine surgery that combines endoscopic visualization with spine fusion to stabilize and decompress the affected segments. In short, EndoFusion is a type of spinal fusion done with endoscope and tiny instruments aiming for the same stability as traditional fusion but through a much smaller opening, reducing the collateral damage. How is it different from traditional spine surgery? In a traditional open fusion, the surgeon makes one long incision and must cut or move aside large muscles and tissues to reach the spine. This causes more bleeding, muscle trauma, and a longer recovery. By contrast, EndoFusion uses one or more tiny incisions, often less than 1 centimeter each. Through this incision, we put a screws and an endoscope is inserted, and the camera sends live images to the monitor so the surgeon can see the spine interior without a large opening. Specialized instruments are passed through this tube to remove the herniated disc pieces and bone spurs pressing on the nerves and prepare the space between the vertebrae. Because the muscles and bones are disturbed much less, tissue damage is greatly reduced, resulting in less pain and faster healing. In short, spinal fusion is achieved without disruption of the body. As a result of which, recovery is quicker, faster, muscle trauma is less blood loss and least nerve damage. Who is eligible for EndoFusion? EndoFusion is aimed at patients whose spine problems need fusion for stability. Typical candidates include people with degenerative spine conditions, for example, patients with degenerative disc disease, Spondylolisthesis, what we call it as slipped vertebrae, spinal stenosis, or certain fractures may be considered. Doctors usually suggest EndoFusion when conservative treatments like physical therapy, medication, pain management haven't helped enough. Candidates should be in good overall health and have a spine problem that is limited to specific level that spine surgeon can reach with small tools. In other words, a good candidate might be someone with a painful, unstable disc or vertebra at 1 or 2 levels who is otherwise healthy enough to undergo surgery. How EndoFusion is performed? EndoFusion can be done either under local anesthesia, epidural anesthesia, with spinal anesthesia, or with general anesthesia. Most of the time we do under general anesthesia. If patient is very sick or having lot of comorbidities, we do even under local anesthesia. After patient is lying down on his stomach with the back painted and draped after anesthesia, endoscope is passed to the desired level, and without damaging the muscle, the bone is drilled and the desired pathology is reached, where you remove the offending agents like disc, the ligament, the bony spurs, everything is removed, and once the disc is removed, the end plates, what we call, is prepared. We call it as bed is prepared, and the patient own bone chips are filled into the space endoscopically, and a spacer is placed through the endoscope. So this avoids muscle trauma, bone trauma, and the nerve injury. Once this is done, then any other compression onto the opposite side is also relieved. So all the pressure on the nerves is relieved. At the same time, the disc is taken care of, the spacer is placed. Once this is done, then with the tiny small holes, the screws are placed and rods are also inserted with the latest technology we have today. where we call it as minimal invasive spine fixation. Once this is done, the EndoFusion is completed with small tiny holes which are sutured, or sometimes a glue is applied even without sutures. The resultant outcome is comparable or better than open surgery is because you have done a less muscle trauma, no blood loss, no bone damage and no nerve injury, and the visualization is such that you have done the removal of all the offending pathology with utmost care not to injure the muscles. Recovery is faster, going home is faster, joining back to work is faster. So that's the advantage of EndoFusion. What are the benefits of EndoFusion? Because it is minimally invasive, EndoFusion offers many patient-friendly advantages. Smaller incisions, less pain. With only tiny cuts, the operation causes far less damage to muscles and tissues. Patient reports significantly less post-op pain compared to open surgery. This also means they often need fewer painkillers after the operation. Less blood loss and scarring. The smaller incision lead to minimal bleeding during surgery. There are also only tiny scars left on the skin, which is cosmetically better than long open incision. Shorter hospital stay. Many EndoFusion patients go home the next day or in 1 or 2 days from the hospital. In contrast, open fusion might require a longer stay. Faster recovery because the body was disturbed less. Recovery is quicker. Patients are usually up and walking sooner and can resume light work, daily activities immediately, like showering, walking around the next day itself. Lower infection risk. Smaller wounds have lower risk of infection than larger incisions, especially in elderly. Similar stability and relief. Importantly, EndoFusion achieves the same goal as traditional fusion. It permanently stabilizes the problem segment of the spine to prevent painful motion. Studies show that, well done for appropriate candidates, endoscopic fusion provides a good long-term stability and pain relief, often compatible to open surgery. In summary, EndoFusion tends to give patients the benefit of fusion, a stable spine with the perks of minimal invasive surgery. One source notes that minimal invasive fusion procedures offer faster recovery times, reduced blood loss, less muscle damage and less post-operative pain compared to traditional open methods. Other reports agree patients usually experience shorter hospital stays, typically a day or two, and can resume the daily activities within weeks rather than months. Recovery and aftercare, when we compare after EndoFusion, patients will recover more quickly. You will likely to be encouraged to walk soon because early movement helps prevent complications. Most patients stay in the bed only briefly and begin gentle walking as soon as they feel able, especially within 24 hours. Expect to feel some soreness around the incision sites for a few days, but usually much less pain than open surgery. Full fusion of spine takes time, often few months, to bone solidly heal, so heavy activities are restricted. In general, patients avoid lifting heavy objects at least around a few weeks to few months for better recovery. By about 4 to 6 weeks, many patients are feeling much better and may be cleared to gradually return to more normal activity, including light exercises. Full unrestricted activity, especially heavy lifting or sports, might wait several more weeks or until surgeon confirms the fusion is solid. Risks, when we compare, EndoFusion is generally safe, but like all surgeries, it has risks. The most common risks are infection, bleeding, nerve damage or spinal cord injury, which is way less compared to open surgery. Who can benefit from EndoFusion. Usually, patients with specific spinal problems like a degenerative disc or a slipped vertebra who needs fusion for stability and who are in otherwise good health. If your pain is due to instability at 1 or 2 levels, yes, EndoFusion may be the option. The surgeon will review your X-rays, MRIs to decide whether your spine problem is fit for EndoFusion. Is EndoFusion as effective as traditional fusion? Yes. For the right patients, it achieves the same goal of fusion and nerve decompression as standard surgery. Clinical reports indicate that when properly indicated, endoscopic fusion yields excellent results. Patients often experience a significant reduction in pain and return to function comparable to open surgery. How quickly can I go home and return to normal life after EndoFusion? Many EndoFusion patients go home 1 to 2 days after surgery. You can expect to start walking immediately, even on the same day. Light activities like walking around the house or office are usually okay within few days or weeks. More strenuous activities, heavy lifting, bending, typically wait for about 4 to 6 weeks. Most patients resume desk work or driving within few weeks, but this varies by individual and should follow your surgeon's advice. Will I have a lot of pain after surgery? Typically, not as much as open surgery. Patients often report much less pain because the muscles were largely spared. You may still have some soreness around the incision sites, but this usually improves quickly. Because of less tissue damage, patients need fewer painkillers and instead manage with mild pain relievers. What about the scars? Scars from EndoFusions are very small, often less than 1 centimeter or less. Patients appreciate the cosmetic benefit. One source points out that endoscopic surgery leaves minimal scarring because of tiny incisions. How long will the fusion actually takes to heal? Bone fusion across the vertebrae usually takes a few months. Even though you may feel better within weeks, you should still avoid high impact activities until the surgeon confirms that the bones are fully solidified on X-ray or CT scan. Your doctor will give you guidance on exercises or physical therapy during this period.